Hi, my name is Jordana Gilman. I'm a third-year resident at the University of Rochester in OBGYN, and this is my presentation, PROMIS Score Changes in Women with Stress Urinary Incontinence Treated with Pessary versus Retropubic Midurethral Sling. None of my co-authors nor I have any financial disclosures related to this research. Stress urinary incontinence is leaking with coughing, laughing, sneezing, or any increased abdominal pressure. It is extraordinarily common and has huge impacts on patients' quality of life. Treatment includes behavioral modifications, pessary such as the one seen here, or a midurethral sling procedure. PROMIS is the patient-reported outcome measurement information system, which was developed by the NIH to provide standardized patient-reported outcome collection measures. Since the greatest impact of stress urinary incontinence is on quality of life, it's important to use a validated quality of life measure to evaluate people's outcomes. And this is validated in urogynecology research. Based on prior research, our hypothesis is that surgical management of stress urinary incontinence will be associated with improved patient-reported outcomes when compared to pessary management. We used a chart review combined with automatic demographics data pull from electronic medical records and PROMIS data, which patients filled out on iPads prior to their visits. And we used 5 separate visits for each patient. Patients were divided into 3 groups: pessary, surgery, and crossover from pessary to surgery. We used one-way ANOVA to compare means of continuous variables and chi-squares to compare the other variables. And we used Glimmick's general estimating equation to determine changes in PROMIS over multiple visits. The total number of patients who were eligible were 223. We removed those who didn't fill out any PROMIS questionnaires, and we were left with 95 patients in the pessary group, 71 patients in the surgery group, and 22 patients in crossover. These groups were overall fairly similar, though surgery was slightly younger, slightly thinner, had a slightly lower comorbidity index score, and was more likely to have private insurance. Our crossover group fell in the middle of the pessary and surgery group. In our outcomes, we found that overall, surgery patients had lower depression symptoms. The smiley faces on the side indicate that a lower score on your PROMIS survey indicates a better depression outcome. So this is the surgery group. Crossover is in the middle, and pessary had the highest depression symptoms. Physical functioning was also overall the best in surgery, though crossover group did have an increase in physical functioning self-reported at the second visit. Pessary remained the lowest in physical functioning. Social functioning, again, the pessary group had the lowest social functioning, and the surgery group overall had the highest social functioning. BMI played an important role when we explored for covariates. We looked at age, BMI, comorbidity index, gravidity, and parity. BMI impacted physical functioning and social functioning the most. For example, when looking at the effect of BMI on mean social functioning T-scores, we saw that compared to a BMI of over 40, the group with a normal BMI had a significantly increased social functioning T-score. Stop by the poster to learn more. Thank you so much.